So that's a good conversation. You can say, well, the capsule doesn't resorb, and then you can say...
Because if you leave it behind, it's behind.
Yeah.
It's going to stay there. And so that's why it's so important when we're doing these operations to be able to do a total en bloc capsulectomy, to remove all of the capsule tissue. And by taking all of the capsule tissue out, then we're leaving a space that is capsule free. And because if you don't get it all out, it's going to stay there and be there really forever.
Yeah, I think removing the capsule gives us a couple things. First, we can send that tissue for bacteria, for fungus mold.
CD30.
Send it for a CD30 immunostain for ALCL lymphoma. Send the tissue for breast cancer to rule out a breast cancer. I think that's all very important in sending the capsule. I think another big piece is for some people the capsule can be very thick, and that's where they have range of motion issues, problems with pain in the neck and shoulder. And I think from a functional standpoint, removing the capsule is important.
And it's scar tissue, so it can sometimes tether the overlying tissues to the deeper stuff and create sort of a discomfort with movement, and that's the thing we see commonly against the chest wall. It leads to the ribs, it can stick.
And we always remove the capsule. I think it's really important in doing a total en bloc capsulectomy to remove the entire capsule because of this concern for ALCL lymphoma, because of some of the other things that we've talked about, being able to test the tissue for bacteria. We had a lady just the other day who had fungus in her capsule, and that may have been the reason that she was having her symptoms, but had we not taken out her entire capsule, we never would have known that.
And it's difficult. It's hard. It's not easy.
Hard.
It's not easy to take out all the capsules. So to be completely fair, it's a surgical procedure that does require some commitment, some time, and real dedication to get all the bits of capsule out. It can be really stuck in certain parts inside of the chest, and we really do sometimes have to work pretty hard to get the entire capsule out. So I would say it's not a chip shot.
Yeah,
it's actually a lot of work.
There's a learning curve. I mean, I think we both
Yeah.
had our learning curve to really understand how to do a total en bloc capsulectomy and to be comfortable with doing it and do it in a way that it's consistent and be able to remove the entire capsule.
And one other point I think that's really interesting is there's a big difference between a capsule that forms around an implant that's under a muscle versus an implant that's over the muscle.
Such a good point.
Yeah.